So I think the Netflix series about Jeffrey Dahmer and his life really portrays an interesting aspect, psychiatric and psychologically. And so we'll just take a look at some scenes here. And mom is pregnant, shows her taking medications, doing activities to try and help her relax or calm down. And this can have certain implications on the fetus early on in its life. Even the mother dealing with anxiety or depression or psychotic symptoms, not only can it make her difficult to take care of herself, but difficult for her to care for others as well, including the babies. Be concerned about the fetus, especially with Valium, phenobarbital. Again, those can cause brain and spinal cord damages. Clearly, they're portraying the mom as distressed, not able to have much comfort or relaxation or peace in her life. And so this can not only provide a tumultuous environment for her, but for the fetus as well. So the doctor says it'll be better to do it without medication. And now, maybe that was true in the 1950s, but nowadays we do have medications that help, can be safe in pregnancy, or at least it shows that the benefits of providing medication, certain medications at times can outweigh the risks. So in the first scene, we were able to see a little bit what environment may have been like during his mom's pregnancy. And in the second scene, we're going to begin to see what it was like early on in his childhood life. That his mom seemed to still be dealing with depression and not only not able to care for herself, but not able to give the care and affection that her children needs. And so in this scene, Jeffrey walks in, hears his brother crying, mom is not present, and just gives us a glimpse that probably he didn't have a good attachment to his mother or a good attachment to his parents, which is actually really important for a child to have a healthy, normal upbringing. Jeffrey calling the ambulance on his mother is also can be a source of trauma or a reason that a child will be emotionally unstable. Sometimes we find this in people who are addicted from a young age to like drugs. Their parents might ask them to go get them a beer, or go get them a cigarette. And so those kind of things, even though it may seem little at the time, can actually have big implications down the road on a child's life. Not only does the movie show us that the mom can't really be a good parent for Jeffrey, but also mom blames the father as well for not being a good parent to Jeffrey also. Another exposure to trauma that Jeffrey has is this scene here shows his parents yelling and fighting with each other, and that can be a source of emotional trauma in children. A child's relationship with the parents has big implications on how they see the world, how they see other people, how they even see themselves. And so a secure and trusting relationship with one's parents, for example, the parent will be there for them, they'll provide for them emotionally, maybe physically with foods, that the parents are there is important for a child to grow up healthy, without anxiety, and be able to manage stress well. But if the parents are not involved, there's not a caretaker involved, maybe there, it could be grandparents or aunts and uncles or adopted parents, someone to help fill that role model role in a child's life. If no one is available, the child's going to be more likely to be anxious, depressed, just not be able to easily deal with some of the stresses that life can bring. This next scene shows what Jeffrey used to cope with some of this life, and also shows some of the bonding that him and his father did do, which may have been limited, but it was through this dissecting of dead carcasses and talking about the body and the organs and things like that, same principles that Jeffrey would apply later on in his life when dealing with humans. The next few scenes will show us on one hand how Jeffrey appears as socially awkward as a child and in high school, yet on the other hand seems to be very gifted when it comes to dissecting and nature and remains, things like that. The next scene in Jeffrey's life really shows like a breaking point where it's in the midst of his parents' divorce, and he has like a void now in his life where his mom is no longer living with him, and his dad is focused on his girlfriend and basically not on raising the family. So Jeffrey is left to take care of himself, and yet he's old enough to live on his own, yet not quite mature enough to take care of himself. And he seems to resort to drinking alcohol to try and fulfill that void that's in his life. The next scene is Jeffrey's first killing, and the main thing I want to point out here is the reaction after he killed his first victim. And so when I was a medical student and working in a child and adolescent rotation, there were teenagers that would fight other teenagers but claim that they blacked out and did not remember or recall the circumstances around the fighting. And so the attending physician at this time attributed this to cases of trauma. And so in Jeffrey, we've seen particular how he's exposed to emotional trauma growing up, his parents fighting, maybe not around, maybe he was neglected when he was growing up. And so this can cause extreme levels of anger or sadness. And both of these emotions, we know Jeffrey is shown as portraying those emotions after this killing. Also, he claims that it was an accident. The first time it was not intentional. See that Jeffrey is portrayed as this alcoholic, or someone who's been resorting to alcohol after his parents' divorce. And we see that in his first year of college, he basically is flunked out, and a lot of that is contributed to alcoholism. And so his father tries to deal with Jeffrey getting flunked out of college by helping him shape up and go to the army to basically get discipline and his life in order. Although still bringing those habits with him from the army, it takes a lot more than just discipline or willpower to resort to sobriety. Sometimes it takes 12-step groups, sometimes it'll take both psychiatric intervention like medications and then psychological counseling. Maybe it's also group therapy, like the 12 steps are typically the most effective, but it takes a lot more than just willpower, discipline to reach the sobriety levels. The next scene will show Jeffrey have interest or sexual pleasure through an inanimate object, such as this mannequin, which is part of Fetishistic Disorder. And then we really see how it's a disease in Jeffrey because of his reaction when his grandmother removes the object. He gets extremely angry, is very intimidating, breaks a glass. And so sometimes we may see something like that and it can get misdiagnosed as bipolar disorder, but here it's very clear that his reaction was because that object which he found so much pleasure in was taken away. Sexual gratification that Jeffrey gets seems to continue in public places, as shown in the next scene. And not only does that lead him to have legal problems as a result, but also cause him to lose his job, suggestive that, there is mental illness playing a role. And as a psychiatrist, I often assess military experience and discharge status. And so in this scene here, it says that he was discharged honorably and that he had an alcohol issue, which may have caused the discharge. But typically, if someone has an alcohol problem or a medical condition and is discharged from the military from it, it's usually called a medical discharge. Or in Jeffrey's case, he may have also had a dishonorable discharge, because to have a honorable discharge, usually it's someone who completes their service in the military or army faithfully, and doesn't seem like he was able to do that because of his alcohol issues. The next scene just shows what Jeffrey did to get his victims unconscious, and it looks like he offers them a drink of alcohol and tries to spike their drink. And so the reason I'm showing this is because it just shows how much planning and meticulous action that he did in order to have his victims. And typically, if someone has a very severe mental illness, usually it's so severe that it affects their mental and cognitive function, and they're not able to carry out some of these complex tasks. But in Jeffrey's case, he was able to carry out the tasks, suggestive that perhaps he did know the consequences of what he was doing. So if Jeffrey knows the consequences of his actions, it's unlikely that he'll be deemed guilty by reason of insanity. So far we've basically looked at what led Jeffrey to perhaps do the things that he did. He didn't have a good relationship with his parents growing up. He didn't have those close attachments. He was basically anxious, insecure kid. He resorted to these feelings with alcoholism. He was exposed to various traumas early on in his life. And we can see that the alcoholism sort of leads to this pattern of instability. He's not able to finish school, not able to hold down a job. His childhood upbringing, we see that he's basically gotten pleasure or sort of closure or comfort through that activity that he did bond with his dad, that is carving up or dissecting animals. And then this basically sort of progresses into humans. About 13 innocent victims later, Jeffrey finally gets caught. He's incarcerated. And so we're gonna see a little bit what happens while incarcerated. Before he decides to sort of reflect or have remorse on what he did, he gets basically a letter from a fan sort of supporting what he did over his years and even giving him money. So in a way, this is a form of like positive reinforcement where it sort of encourages some of the behaviors that he did. And so as supporting some of those behaviors sort of puffs up his pride, his ego, as he sort of brags or boasts about what he's done in the past. Later on in his time incarcerated, Jeffrey is put on medications, which he says helps his mood. And Jeffrey begins to model his life or look up to someone who was a serial killer before him, then later repented, found God, and then got the death penalty and confessed that God forgave him from his sins before he passed away. And so this Netflix documentary does a nice job of sort of intertwining the end of the other serial killer's life that Jeffrey looked up to Jeffrey being baptized into the Christian faith, because it's also part of the Christian belief that once you are baptized into Christianity, that old person, the old man who dealt with all the sins, so Jeffrey's difficult upbringing, the sins, all the bad that he's done, the evil that he's done in his life, and he did a lot of evil. There's even periods of the show which shows that he had a Satan altar for Satan, and that he worshiped Satan. And so basically all those evil deeds that he did are washed away in the baptism, and now Jeffrey can be a new person, focus on holiness and forget about all the evil that he did. And it's believed that Christ can forgive at that point. I think if you look at Jeffrey Dahmer's life, you can have many reasons to grow up with psychological or psychiatric issues. And if he got the proper treatment, that may have prevented some of the killings and murders to happen. Although I think most importantly, raised and grown into the Christian faith, that may not have prevented the mental illness from happening. Greater chance, I think, of preventing some of the killings and innocent victims and lives being lost. As I mentioned, people with severe mental illness typically are not able to carry out the complex activity that's required for murders, even for suicide. Yes, it can happen, but typically it happens with people who are intelligent, who are able to carry out those acts. In Jeffrey's case, yeah, there seems to be mental illness involved, but if he found Christ early on in his life, it probably prevented all those tragedies from happening. Be sure to subscribe to the channel if you haven't already. Drop me a comment, say what you liked or did not like about the video.